Okay, so today we are in Brownsville, Texas at DHR Health's hospital, which is just a year old now, and delighted to be speaking to Dr. Karen Brooks, who very recently joined the team here at DHR, and so we're going to interview Dr. Brooks about what she's doing here, what her specialty is, how she got here, and basically the state of healthcare in the Brownsville area. So Dr. Brooks, great to see you.
Nice to see you, sir.
Yeah.
Happy to be here.
So tell us a little bit about yourself to start with, where you went to medical school, residency programs, and your career, your journey to this point.
Okay, I went to medical school at University of Texas in Houston, and I got my MD degree from there, and then I went to University of Florida in Jacksonville and Gainesville and did my surgical residency, internship and residency. I was very lucky because I was able to then go for 10 years and work with my father, who was a well-renowned general surgeon in Lufkin, Texas, and I was able to be under his wing, and he was able to teach me further some tricks of the trade. So I spent 10 years with him, and then for other reasons with my ex-husband at the time, we moved down here to Brownsville, and I've been here for 22 years. I moved here with my 3 sons who are now grown, but it was a great place to raise them.
So if you've been here 20 plus years, for you, the Brownsville area, the Rio Grande Valley must be special.
It certainly is. This is home for me. I don't plan to go anywhere else.
No. So tell us a little bit about your work here at DHR. You've been here just a few months. What is your title here? And
I started here in October last year. The hospital itself opened, I believe, in April. So we're just celebrating our 1-year anniversary for DHR in Brownsville. I was in private practice in Brownsville for 20 years before coming here. I was hired to be the Director of Surgery and Director of Quality for DHR Brownsville. I have established my practice now. I'm actually hired by the hospital, and I moved my clinic into the multi-specialty clinic. Right next door we have a large clinic here. We have a lot of physicians coming from Brownsville, and also we share with the Edinburgh campus a lot of physicians operating here also.
So this role as you're the Director of Quality in Brownsville, when you arrived, what did you think of that? What's the quality level here at DHR?
Well, DHR is an exceptional hospital, and I'm very, very excited to be a part of it. I think we're bringing a new level of healthcare to Brownsville.
And so because DHR Health has only just got established this first year down here in Brownsville, and you've only been here a few months, so perhaps you may not be the best qualified, but let's see, what do you think, what's the feedback been like?
Well,
patient?
I have the same patients now as I had in private practice. They've all followed with me to my clinic here, and the patients that I've brought to this hospital really like the service. The hospital is brand new. It's 1 year old. We have 56 beds. We have 3 ICUs. We have 6 operating rooms, state-of-the-art equipment, and the families and patients coming through are so well taken care of, and they're really happy to be here.
So you said earlier you had some experience in Florida and Lufkin, Texas. Are there any special challenges for you as a physician here in the Brownsville, the border area? Is there anything sort of unique about the area?
There certainly is. We are an underserved area in medicine. Every specialty needs more doctors here. It's been a little difficult for most of the hospital systems to draw physicians here, but the ones that are coming to DHR, we have an exceptional group of physicians working. The main problem, as I see it, is that there are not enough physicians. It's very difficult with patients as far as their financial status. We have a lot of Medicaid patients which are well served at DHR. DHR actually serves the Cameron County indigent patients, which I used to do a lot of, and then it went away, and DHR is the first place that I'm back to that they're retaking those patients. They have a program, DHR Cares, that's also for indigent patients to help them with their finances.
So for the residents in the Brownsville area that haven't heard of DHR, this is an opportunity for you to to make a pitch to them, to tell them this is
It's
a
a
fully
full-fledged
yeah.
hospital, and we're day by day improving the hospital, gaining more services. Our radiology department is open for outpatient procedures. We have a CAT scan, we have ultrasound, we have plain x-rays. We have mammography and breast ultrasound being instituted right now. We have a brand new MRI machine that's coming in.
The Edinburgh facility, obviously 20 years older, that's grown and there's a lot of specialties there.
We have access to all of them, and that's what really makes this area and this actual hospital nice, that we are able to bring them here, and they're helping with the surgical procedures here in Brownsville. The patients in Brownsville can stay at home. Certainly if there's a specialty that they cannot do the procedure or not doing it yet here, they will take them to Edinburgh, and they're doing renal transplants. We have liver transplant about to start, so there are a lot of the campus is a big asset to have in our backyard. Edinburgh is in our backyard.
Mm-hmm, yeah. So what was the first anniversary just passed?
Yes.
Was that celebrated well?
Yes, they had a big function in the front of the hospital. All the staff was given a nice barbecue, and the community was welcomed.
So yes, it must be important to you to build that community spirit and network.
Yes, we've been here in Brownsville just a year, and I think the hospital has done a really good job in reaching out to help with all the community affairs. We helped with the toys with the police department for Brownsville at Christmas. We've done